America's healthcare leaders are among the most committed and hardest working executives anywhere. But when today's healthcare leaders step down, who will take their places and continue to make sure our hospitals and health systems are the best they can be? The complexity, challenge, and inherent value of a career in healthcare management attracts a unique kind of leader. This kind of talent has never been more needed than now, when the field is faced with an unprecedented level of disruptive change. It's more important than ever that tomorrow's healthcare leaders are equipped with the vision, experience, and innovation mindset to address the issues that lie ahead. In this edition of Advancing Health, 3 experts from AHA's Center for Health Innovation discuss what will be required of the next generation of healthcare leaders. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hederle, senior writer with AHA. In this episode, we're talking about leadership, more specifically, the skills that will be required to successfully lead healthcare organizations into the next decade and beyond. Our experts will also describe a new resource called the AHA Next Generation Leaders Fellowship and its potential for developing the talents of the men and women who will lead our nation's healthcare into the future. Moderating the discussion is Lindsay Bergstahler, Vice President, Programming and Intelligence. She's joined by colleagues Dr. Jay Bott, Senior Vice President and Chief Medical Officer, and Andrew Shin, Chief Operating Officer. Let's join them.
We are here to talk about leadership because we know that leading a healthcare organization today is more challenging than ever, in part because hospitals and health systems are more complex as organizations than ever before. And leaders who oversee them must lead them through a period of time that's really marked by rapid change and transformation. Leading a hospital was never an easy task, but a number of forces have made it more challenging than ever. Jay, can you share some of your perspective on leading organizations in this era?
What I've heard is that this is not only an extraordinary and interesting time in healthcare, but a challenging one. Some of the playbook around leadership that we may have had in the past needs a refresh and an evolution in this current context. And so the notion of being bold is important. The notion of making an effort to providing voice on challenging issues, because sometimes being uncomfortable is tough. And so in order to get the issues that need discussion and to wrestle with them, we need as leaders to be able to put that forward. And then I think this notion of we've been oriented around planning and organizing, which still has its place, is important. But I think that the future of health and the future of work in healthcare will require less planning and more adapting. Looking outside of healthcare is critically important too. So when our leaders bring forth standard-setting approaches from other industries to healthcare, we can see a real shift in innovation and improvement in our own sphere.
Yeah, Jay, that certainly resonates with everything that I think we've all been hearing. And even in the past week, I was down in Louisiana speaking to a room full of leaders down there, and specifically from the rural context. It's really incredible to see all the common challenges and yet opportunities that as a field we're seeing, and it cuts across different communities, different parts of the country. They all have different flavors, but there seems to be something different today when you talk to health system, hospital leaders about the changing environment, the pace at which we're changing, and the skills, the frameworks, the mental models especially that are necessary to really drive our system into the future. And so I think that you're right on when we think about the opportunity that today versus yesterday, a few years ago, presents itself to really say, as a field, what are those type of leadership attributes and competencies and networks that are so essential to transformation at scale? And so in thinking about how the center, which was formed about a year ago at the AHA, the Center for Health Innovation, how it can fulfill its charter, if you will, of supporting the field in their innovation transformation journey, one of those aspects that really came up was how do we help that next generation of leaders really gain the sort of perspectives and voice necessary to help our field transform. And so that, as you very eloquently mentioned, involves a whole host of different areas, but it also involves thinking about how we can bring in voices from outside of healthcare, how we can help connections between existing or current leaders and that next crop of leaders who are going to be assuming those roles in the very near future, if not already, as well as connecting across different organizations in healthcare. And so I think that when we think about how do we take what you just described as what's happening in the environment and actually create a network and a community, fostering that within the AHA membership, that's how we thought about creating an opportunity to help support that next crop of next generation leaders.
And I think we've heard from our members that it is challenging, and the current leaders have sort of had to learn on the job and through experiences, maybe lessons learned and some failures, and the opportunity to really, again, like you said, Andy, create a community for emerging leaders so that they come in with a little bit more background and understanding of the challenges ahead that they may not learn, probably don't learn in their formal education that they have going into their leadership roles in their organizations.
And I think Andy's been, was spot on in his comments about what the opportunity is and the transforming environment. And I think, Andy, you point to sort of this notion of mindset, practice, and transformation shifts that need to happen, and really also the importance of connectivity, collaboration, and curiosity. And sort of that coming together, I think, is really important for the field in this time.
It's definitely how we describe the innovation framework, specifically at the Center for Health Innovation, and it seems to apply in a pretty seamless way to all the activities we do, including this new fellowship program that we're working on.
So, Andy, you mentioned that we've been charged by our members as the center to really develop this program, and I've been part of the team doing that. And it's been a real pleasure really over the last few months trying to answer this question of what makes a successful leader. And we're trying to answer that question not as we might answer it today, but really 5 to 10 years from now, because we're looking at those emerging leaders who would be in the C-suite 5 to 10 years out. And we expect that we'll be operating in a much different environment. And so when we are operating really truly where we've shifted the focus from treating the sick to keeping people healthy and managing health, and we're paid more consistently on value and outcomes, not just volume. When care isn't just taking place inside the hospital, of course it's not now, but even more so at more appropriate sites of care, maybe at the home, maybe anywhere on a smartphone, we will really have different types of leadership skills that are emerging. So maybe you can talk about some of the things that we've uncovered if we dug into really, there's a lot of skills we've talked about, but which ones are becoming most salient?
Sure. Really what I'll describe for you is almost a year's worth of interviews, research, conversations with thought leaders, our member leaders, those voices outside of healthcare or hospitals and health systems that really influence what we call our pillars that we're basing all our programming on in terms of the next generation leadership. And so we've just spent a few minutes talking about that changing landscape, and navigating that new healthcare environment and competitive landscape is becoming more and more important as we think about the role of what a hospital health system leader must be able to do. And so that means everything from identifying what forces are a potential disruptor to the current paradigm to how do you think about competition or substitutes to care delivery, for example, in new and different ways, really with that bent towards consumerism and patient experience and where those two overlap. I think that as you think about where as an organization or even as a field we have built or need to further improve our innovation capacity, that is a huge area. And you talk a lot about innovation culture as an example. And so, clearly we have to do a lot of work around how do you foster, develop, and sustain innovation cultures within organizations, even as a field. And so there's a huge focus on that part of the work in terms of what a next generation leader needs to have. And then really thinking about change management, what I call positive organizational change. That used to be something that happened after maybe a merger and acquisition. It would be something when a new leader comes in. But what we hear from talking with hospital and health system CEOs is change management has become part of the daily job requirement. And so how do you then change the mindset and practices from a once in a sort of blue moons type of activity to this is part of my job as a hospital CEO, to do change management effectively and to arm my team with those tools and capabilities as well as expectations. Clearly, we have to think about digital transformation. And so that will be something that I won't spend too much time talking about here. In many other podcasts, we've talked about the role of digital, thinking about it differently than just sort of something that is cool and shiny, but more as a new asset class. But I would say that one of the biggest focus that we also need to round out this program with is leading the shift of healthcare to more well care. And so we talk about that at the AHA as redefining that H. When you think about that blue hospital sign on the side of the highway, it used to mean a building with 4 walls. And now we really think about it as something more around how do we, as either anchor institutions or as parts of collaboratives, create and foster a culture of well-being within communities and for the patients that we serve.
That last one that you mentioned, shifting more towards well care, is certainly a major focus of the fellowship, and one that as we talk to members, realize we're going to be spending the most amount of time as we develop the experience for the fellows so that they can spend time together really exploring the challenges and the opportunities around this shift. Jay, I know this is a key focus of yours as you've worked with our members and others on advancing and accelerating new care models. Can you talk a little bit about your experience there?
Sure. I think now more than ever, it's critically important that we look at care models that move towards health, as Andy alluded to, this redefining of the H, so that hospitals and health systems have care models that meet the needs of their communities, not for today, but for the long haul. And so we're seeing really deep conversation in health systems that we're working with around what is the continuum care model look like around primary care as well as post-acute. And then what does it look like around challenging issues like behavioral health or maternal health or kidney care or oncology care. So those are even in some of the specialty areas. But we're seeing certain communities are playing also an important role in helping redesign the system with their hospital. So you're seeing that community members and community partners and stakeholders, including employers and payers, getting involved in redesigning the care models of the future. And we see the opportunity to make it easier for patients and not make them work harder. And this also can be helpful in terms of care model design for the caregivers, the care team, and for families. And so we're seeing patient and family being at the center of these care models being redesigned. And, as those in the consumer experience industry would say, that customer obsession is really important, and designing for the needs of the customer. I think we're seeing that really become important in healthcare. And this notion of hospital at home and use of remote care monitoring, telehealth, and figuring out how you use those different components to deliver a seamless care experience is really exciting. And then comes sort of follow the money, right? So what are the payment models that help incentivize the delivery models that we think can best deliver on health? And I would say that technology is here to stay, but really needs to enforce these new care models rather than being fragmented and disconnected from them. And so let's make it easier for the field to redesign these care models. And one which I'll talk about that's really been interesting to work on is the age-friendly health systems care model for improving the health of older adults.
So we've talked a lot about the environment and the challenges in it, but really some of the exciting opportunities, particularly around putting customers at the center, transforming digitally, exploring new care models. And these are hopefully the challenges that are getting emerging leaders excited about being in our field and staying in our field, because these aren't easy, but they can have significant impact on the experiences of the patients, which is ultimately what we're trying to address. So let's shift now to talk a little bit more about the program. We talked about the 5 pillars that will be included and incorporated throughout the curriculum, but let's get into a little bit more details about what fellows or the mentors who sign up to work with the fellows can expect from the program, Andy.
Sure. When we were thinking about building this program, we really didn't want to be duplicative of anything that was already offered in the field. So this wasn't going to be a set of modules and coursework and homework and essays or books, book reports. We really want to create an interactive, collaborative learning environment, a very intimate network where we could bring that next generation high potential leaders together along with our leaders of today, as well as some voices from outside of healthcare. And so this is going to be both in person, but a lot of virtual learning. And we're going to be asking people to bring their experiences, their models, and listen, all models are flawed, including the ones in our head. And so this is going to be about sharing. What have you succeeded at? What have you failed at? And what have you learned along the way? And so through that community of practice and inquiry that we're creating, we hope that this fellowship network will become a support system for one another and really be a great opportunity for both mentors, mentees to be able to bring back to their organization some of those new tools and capabilities. We're, again, trying to focus on this high potential peer and mentor component that I've been alluding to. And so we're going to have a focus on creating and fostering connections between today's and tomorrow's hospital health system leaders. We're going to be thinking about, because we want to make sure that it's actually tangible, how do you take a project that you've been working on in your organization or something that you can actually take from start to maybe not finish, but make some progress on during the life of your fellowship? And what better way to make progress on a big organizational initiative than to have the hospital CEO of a major health system that might have just done that particular initiative on their own before, or from colleagues who are maybe going through some of the same struggles that you are. It's just a great sounding board to be able to advance a particular initiative or a project. And then finally, we are working with some of the leading health systems around the country, companies outside of healthcare, including our corporate sponsor, Accenture, to really think about how does digital transformation play into the field's transformation writ large. And so we're really excited to be able to have not only the conversations, but the experts and the paradigm examples from those, both inside and outside of healthcare that will, I think, add to a really robust community.
And I think that one of the key points there is it is really being designed to learn from each other, to learn from mentors, rather than your typical experience where you're learning from an instructor or professor, for example. We have a great opportunity for a segment of those emerging leaders around Age Friendly through a partnership we have. Jay, can you talk about that?
Sure. And before I jump into that, I just wanted to reflect on what Andy said, and I think is spot on about the complexities of the environment lend us to thinking about a leadership development experience in which you're hearing from people that have gone through an experience, right? Their own challenges, their own realities, and then reflecting on that in conversation. And so it's not sort of theoretical. It's sort of very real about the tough things that folks may face. And I think that that's really exciting about this fellowship, this connectivity of experience, reflection, and learning that then translates into better impact going forward. And I'm really excited about that part of this fellowship that's unique. And so, hospitals and health systems are committed to improving the health of people at every stage of life. Our aging demographics are going to continue to explode, more than double by 2060. It means that age-friendly care is an urgent part of the mission. And so we worked with the John A. Hartford Foundation, the Institute for Healthcare Improvement, and the Catholic Health Association to deploy a model called the Age-Friendly Health System Model, anchored by the 4 M's, meaning that we're trying to address mentation, mobility, medication management, and what matters. And the notion that all 4 of those have to be deployed together in order to see an impact on outcomes and lower costs. And so we started in 2017 with 5 pioneer systems that included Providence, St. Joseph's, Ascension, Trinity, Kaiser, and Anne Arundel, and have really seen that continue to grow from 26 pilot sites to nearly 350. It's really exciting to be able to take some of the learnings of that and apply it to this fellowship and give experience for a group of fellows that get to advance age-friendly health systems and build that capacity, and they're project oriented around that, but not do that in a vacuum. Do it within the context of the environment and the capabilities and skills that Andy and I talked about, throughout this conversation, that they're really connected together. So you can't advance an age-friendly health system without the capabilities of leadership and management challenges in times of uncertainty and consistency of applying some of those capabilities we talked about. And then, it just makes the work of deploying an age-friendly health system model even stronger. And so very exciting to have this opportunity and look forward to engaging with our members and learning along the way.
I think the projects will be one of the most interesting and exciting elements of the fellowship for us that work here within the AHA and the center to see the types of transformation and impact they'll have with the age-friendly fellows, of course, focusing on bringing those 4 M's into their organizations, and the other fellows focusing more holistically on the types of changes to be more consumer friendly, to be more digitally transformed. So it'll be an interesting experience for us to see how those come in. Jay, Andy, thank you for joining and to share the latest on AHA's work on developing leaders.
Thanks, Lindsay.
Thanks, Lindsay.
And some information about the fellowship to come. For those of you listening who would like to learn more about the AHA Next Generation Leaders Fellowship Program, nominate a Next Gen leader, or apply yourself, visit aha.org/nextgenfellowship.